My name is Adewole Babatunde, and I'm making a presentation on behalf of the Medical League. By the way, it's World Malaria Day, but that's not what we'll be speaking about today. Some information are being shared outside. One of the things that we've had privilege to do in the medical team under the leadership of our pastors is to be able to liaise with members oftentimes when they're receiving care in a hospital or on admission. And I'm saying this is still something that took place even till now. Oftentimes after prayers, we are asked to also liaise with members. And we think that it's important for us to talk about, for us to get the best out of healthcare, it's important that we understand what our rights are as patients and also what our responsibilities are in healthcare. No, I am not a learned person. However, I will be speaking from the healthcare perspective. Now, it's important to understand that healthcare works best when patients and providers work together as a team. Permit me to say that there is a traditional approach in which your doctor is seen almost like a father giving instructions, all right? And we call this a paternalistic approach. This is an approach that is fading away, and the aim of healthcare now is for us to have what we call a patient-centered approach, whereby there is shared decision making. Therefore, it is important that for us to achieve this, there must be effective communication, mutual respect, and understanding of our different roles. So what are patient rights? Okay, in the healthcare system, these are the protections and standards that every patient deserves while receiving healthcare. Now, one of those is to be treated with respect and dignity. That is important. You are not supposed to feel less than a person or less than you are in accessing healthcare. Your healthcare providers are not doing you a favor, they are rendering a service, and you are a client. This is important to keep in mind as we access healthcare. Another right that we have as people accessing healthcare is to receive clear information concerning your health. So what are the information that you should have access to while receiving healthcare? There should be a clear understanding of what is your diagnosis, what is wrong with you. There should be a clear understanding of what are the tests, the investigations that you have done. We have seen people over and over, and we interact with people. I would say, I went to the hospital, I went to somewhere, and they gave me injections. So what exactly were you treating? And unfortunately, they do not know. This is something you should have. You should be able to know what are the available treatment options, and you should know the risks and the benefits. And when I say treatment options, this is important because sometimes there could be alternatives, and you should be able to seek what are the alternatives available. I remember seeing a patient some times ago, and she was diabetic. I thought it's best that we started her on medications. And she said, "Doctor, I do not want to start medications now. I would like to intensify my lifestyle practices, and then we see after some time." And since she was not in an immediate danger, we did that, and the outcome was good. You have the right to know your provider. It's interesting that many times when people access healthcare, we ask, "So what's the name of the doctor who saw you?" And they do not know. And it's not totally the fault of the person accessing care, all right? But that is something you have a right to know. You need to know the name of your doctor or your healthcare provider, and also what is your specialization. I mean, why are you the best person to see me? Okay, I think that is important. Okay, and I think that even if they fail to introduce themselves, it is important that you ask, doctor, may I know your name? Okay, that is not too much to ask for, and you should know who is ultimately responsible for your decisions. It's important to know that many examinations in clinical practice can be failed if a doctor fails to introduce himself to his patient, okay? So I'm saying that is a right, okay? To have privacy and confidentiality maintained. It's important that when you are being consulted, or when that there is privacy and decency. It's not a market. If there are too many people there, you can ask if they can be excused. If you're going to have a sensitive examination, especially by the opposite gender of healthcare provider, ideally they should request a chaperone, meaning or get someone. Usually if I am examining a woman and it's a sensitive examination like a breast examination, I should have a healthcare provider who is a woman there to help her to feel comfortable, and also it prevents other. So it's important to speak up and to ask, all right? It's important to know that healthcare workers have a duty to keep your information confidential, except with your own consent. And this is important for me to say, because many times when friends and family visit, oh, what's wrong with my patient? Because everybody's your patient. But then the important question is, that is the patient's information. You can get the information from the patient, and if the patient allows you, you can be there when they are explaining to the patient. You have the right to participate in treatment decisions, okay? It's shared decision making. We should be able to take an informed consent, and you have the right to refuse medical treatment. It's important. However, please remember that if you are refusing a medical treatment and your healthcare provider feels that it can be life-threatening, you can also be given the option of signing that I fully understand what I am doing, I understand the consequences, and I will still like to decline this treatment. That is protection for the healthcare provider. And it's important to know that when minors below 18 are being seen, they should be accompanied by a responsible adult. And last in this service, we'll continue in the second service, is to say that you should have a safe channel for voicing your concerns. If you are unsatisfied with healthcare service, you should be able to look for where to channel your concerns. Usually there will be complaints and feedbacks. In our public hospitals, you will have what we call Servicom. Servicom usually there, or you can ask to speak to the managing consultant, the supervisors or so, but there is no reason for you to feel less important than a human in accessing healthcare, because it is the duty of your healthcare provider to protect your dignity. We'll continue in the next service. Thank you.